Good morning. This is Sean Murphy of SK Murphy. I'll be your MC for today's PATCA webinar on advances in smart bandages promote wound healing. PATCA is the Professional and Technical Consultants Association. Learn more about us at www.patka.org. We are fortunate today to have a briefing by Joanne Moody. Joanne has 25 years of experience developing medical devices. She's the principal consultant and president of Zeta Scientific, where she provides technical expertise, fresh insights, and solutions to challenging adhesives, plastics bonding, and joint design problems. Her experience encompasses R&D, process, testing, scale-up, product transfers, and low to high volume manufacturing. Joanne?
Well, thank you for the introduction. And I am happy to be here today to talk about technologies that are driving the improvements in smart bandages. You know, all of us have the same problem with cuts, wounds, and scratches that have taken place through our whole life. And we just take it for granted our skin's going to heal. And yet, you know, we are probably not even thinking about the fact that the skin is our largest organ. It protects us, and yet it's pretty fragile. So what it was serious for all of us is if there is a wound that you have that it just doesn't seem to want to heal. And when that happens, you can have anywhere from as bad as amputation to even death. So it's a pretty serious thing to have wounds that don't heal. And my goal today is to give you some background in wound healing, bandage technology, and innovation. So in the area of technology advances, there's really three key points for me to tell you about. One is that we have a need for, first of all, better therapy. We all want to heal faster, and there are some new techniques that can help us help that occur more quickly with things such as electrical stimulation. We also would like to have better materials for more comfort, less infection, and if necessary, if it needs to adhere, it should adhere and come off easily for our skin. And lastly, it would be certainly better to have monitoring that wasn't just visual. So if you need to look at the wound condition, you have to take off the dressing, take a photo, send it to your doctor. And wouldn't it be better if we had some other ways of sensing important parameters of wound healing so that we wouldn't have to remove bandages? And all of this will lead towards what we would call smart bandage technology. So we're going to now go into looking a bit at wound healing. So be ready. There are a few steps to heal wounds, and this is broken down into this way. And we're only here looking at the upper layer of your skin, which consists of an epidermis and a dermis layer. You, of course, can have injuries that go deeper than the skin into the muscle, etc. But we're going to just now focus on a common process for all healing. At the very end of the day, the skin is a part that is the final part to heal. And so the first step of healing, or the injury, really is this red area here. This is called hemostasis, and you have a scrape, you have a cut, and your body immediately wants to stop the bleeding. So you get blood, you want the blood to clot, and that should happen fairly soon, unless you, of course, need to have a tourniquet. And once you've got the blood clot formation, then you move to another phase fairly soon called inflammation. And this is the phase that your body right now is being attacked by bacteria. And so your body wants to fend off and protect itself. So it's going to go in and send in various cells, fluids to fight back. And when this happens, however, of course, the wound starts to turn reddish and it swells, okay, because it's got this excess fluid inside. So we'll move on then, and that can happen that can be like that for, a period of hours to days. And then proliferation is the phase where you're going to start to see the skin formation begin. There's a scaffolding that is put in place. It's very fragile. Another phase is called granulation. It's just the beginning of skin. It's kind of clear that you can't see any real cell, it doesn't look like normal skin. And then when you move on to the fourth stage, which is called remodeling, then it takes actually it can take about 21 days or longer for the skin to kind of continue to build up collagen layers. It continues to get more and more layers thicker, and then eventually it actually, it looks like skin. That's what you want. And the important factor I thought to understand, though, as we get older, why does our skin heal so much poorer or poorly? Part of that reason is our dermis layer will shrink 50%. That lower skin layer shrinks, as well as there's there's another layer between the dermis the dermis and epidermis layer that also shrinks. So we have less to work with, and so that's why healing is also, without disease state, even a little harder to do as we get older. And when you have a wound and someone comes in to look at you, they're going to look at you in a couple of different ways. And the first way they're going to look at you is you as a person, as a systemic factors that make a difference on the kind of care they're going to give you. Of course, they're going to look at your age and your health, possibly genetics, and also what kind of care are you going to have available to take care of your wound, your habits of lifestyle, and also, I mean, are you anxious, hyperventilating? What kind of a state of mind are you in? And all of this makes a difference in how you're going to advance to the next phase of healing. The next area that is looked at, of course, are the very local factors to your wound. And they're looking for infection. Desiccation means that it's a bit too dry. In fact, if your wound is too dry, it won't heal. So wounds need to stay moist, and you keep this in mind as we go through the talk. They might determine that you actually have a pressure wound. If you've been laying in bed a long time and there's been a loss of blood to certain areas, you haven't been moved around enough, and you have a wound where it's a pressure type wound. They're going to look at the swelling. Again, that could be the state of infection that you're at. And of course, dead tissue is a problem and one to look at, as well as maceration it's when it's too wet. And in fact, too wet of a wound can't heal. So there's an in-between phase of too wet, too dry for wounds to heal. So these are factors that are looked at initially for your treatment. Also, what kind of a wound is it? Is it an accident, like a trauma wound? Did you have something become infected over a long period of time? Of course, you can have surgical wounds, and that can be inside your body and outside, and they can cause a lot of havoc. In addition, as wounds become 30-day or longer and can go down to the bone area, they're called ulcers, and these are the very serious wounds. 30 days is kind of the date they use when it becomes a very chronic, serious wound to treat, and not the usual way. Other complications they're going to look for, how much pain are you in? What level of infection it is. You even have some leftover scar tissue in the way, and know that scar tissue can become a complication in wound care. And of course, the worst case, of course, you don't want to have the gangrene. And if you do, that's the case where, amputation may be necessary. The tissue is dead. Now we're going to go through some of the different types of wound dressings, just again as background. And I guess we'll start out with the traditional dressing. And we all know what this is. This is gauze. And gauze has been around a very long time. And in fact, it's become in disfavor because what the disadvantages of gauze are is that it will dry your wound. And remember, we said you don't want dry wounds, they don't heal. So that's a problem. To keep the wound moist with gauze is difficult, as well as if the blood dries with the gauze and you remove the gauze, you're tearing the wound open or the adjacent skin. So gauze we've moved a lot away from gauze. It's still used heavily, it seems, in emergency rooms and various places, but some hospitals actually don't even allow gauze in their hospital area, except for maybe external use. We also have now these other materials, or you may not be as familiar with. Some are polymer based and some are natural based. So a hydrogel is a gel-like material with about 95% water, mostly water. So it's very soothing, gentle. It doesn't stick to your skin. It's commonly used these days for dressings to improve healing. There may be additives added to the hydrogels, and it's becoming a more and more popular dressing, as we'll go into later. We also have hydrocolloids, which are kind of a gel-like material, but also they have adhesion with it. We have foams for gentleness, and alginates are actually well known. I hadn't known about it till recently, but it's a seaweed material with calcium, and it's a highly absorbent material that they apply to all kinds of wounds to rapidly pick up fluids. So like strange positions and areas of your body or during surgery, it's very commonly used. And then also transparent film attached to your skin, but without adhesive. So these are all the things that go direct on the wound. No adhesives on the wound, though. We go then to what goes around the primary dressing. Sometimes they have to be held in place, like the hydrogel, for example. It doesn't hold in place by itself. So we have tapes, bandages, tubes, wraparounds, films, draperies, a variety of secondary materials that go around things. And that's where gauze would fit fine, for example. And we also have some new things going on with our dressings, and we're adding extra chemistry to the dressings, basically. So one of them has adding silver to dressings to as an antimicrobial. There are also nature-based materials used as direct wound dressings, which would be a common one is actually Manuka honey or a medical grade honey. And the only dilemma with that one is if you are allergic to bees, well, you shouldn't use that one. But otherwise, it's a real nature-based one. The chemical below chlorhexidine, very common, being used more and more to stop infections. And antibiotics are used as also like a powder across your room, as well as, oral. And some of the newer additives would be nanoparticles, like they're using carbon nanotubes. Some of the different titanium oxides and different materials are being added again to add properties that benefit the wound healing. And the future one I've included here is stem cells, and medically yet it hasn't become a standard practice. The clinical studies have been rather difficult to perform. I happen to anecdotally know somebody in another country who has had some healing effects with stem cells, so I know there's a possibility there, but it's in the future. We're now going to go through some examples that I think you'll enjoy with a few visuals here as well. So there's again, back to absorbance. There's a material called it's a super absorbent polyacrylate material that goes into absorbing 20% its weight. And there's a lot of fluids that happen with wounds as well during surgery. And I'd like to show you, here's a before foam, and here's an after foam that's in 2 minutes absorbed 20 times its weight. So it really puffs out. And in fact, a month ago I made the sample up, and it has not lost any of the water or the fluid. So it really contains the fluid once it's intact. So that absorbent core works as well as it has to absorb on one side and not release on the other. So that's a really popular new material. The hydrocolloids, talked about briefly, just to show you what they look like. They tend to be kind of a yellowish kind of color. There's other ones with additives I'll show later that look a little different, but these are the ones that have a good barrier film. They absorb fluids, which is nice, and they have a little longer wear time of 7 days compared to the hydrocolloids. And lastly, this transparent dressing, a lot of us have used this. I know a lot of bike riders seem to have accidents with skins and abrasions, and so this film with the little, it has an outside adhesive around the edge, is applied to around the wound, and so the wound has a see-through area. There's actually a dressing on top of this area, and so you can then nicely monitor your wound. It's contained on your skin for up to about 7 days. It's waterproof. It makes a very good barrier and good approach to healing. It's also fairly gentle and safe for fragile skin.
Joanne, does that let UV light go through?
It probably does. Yeah, I would say so.
Yeah. Okay.
Yep. It's a very growing material used for overlays and therapeutics. It's a really popular material. I won't use the brand names, but it's probably all of us have used it at one time or another. So we'll move on now to some of the future therapeutic developments that continue then to further advance our dressings, right? So we have dressings now that can include drug delivery. There's also work being done with chemicals that can be enhanced with light and cause healing. We have electrical stimulation, which it's proven, there's actually an electrical potential in your skin, and when you have a wound, it changes. And so they can actually stimulate growth with stimulation, and it can I've read literature that said a wound healing went from, instead of 12 days, it was 3 days. So they tend to use hydrogels for this treatment because they can be made conductive. So again, that's why I say the hydrogels are showing to have some great potential for healing, as well as they're used, for ECG measurements, for example. Then low frequency ultrasound is also a potential for healing. It's quite low frequency, though, lower than most sets use in the kilohertz range. And then the longer term of development with feedback and artificial intelligence would occur as we learn how to get feedback from these methods.
And what one question came in I missed.
Sure.
You mentioned stem cells earlier.
Yes.
What countries is that being experimented with?
Well,
Where's it taking?
I know in Australia.
Australia?
Yeah,
Okay.
I know of someone who had an Achilles injury and was going to take a trip to Europe, couldn't take the trip, took several treatments in excruciating pain, apparently, and was able to walk again. Came back
Wow.
from the treatment, still had a little flare up, got the treatments, and again, it worked. So I have read they're trying, the literature doesn't show much success yet, and it's because it's more complicated with wound healing. So this was more of an injury treatment, I guess you'd say. But
It
so
wasn't so much an active wound as an
yeah,
injury that
yeah, but
was
that's the
getting.
only one I really personally know of. But it's, people really want to try it, but it's so difficult with the environment of the wound being as difficult as it is. That's why I think it's going to be a tough one to succeed at.
We had a question on are they using transparent dressings on burns as well?
I would I would believe that in some types of burns they would be, but there's some real delicacy with that. They can't have adhesives with burns. So those dressings, the off the shelf ones would have adhesives. So there could well be some transparent dressings. It would make sense because they are breathable, waterproof.
Okay. Well, interesting topic, although a little grim.
A little grim. Gonna get better. We're all gonna get better at the end. I did not show really
Oh,
deep.
one more question, which
Sure.
I also had. So one of the complications, are you going to cover biofilms for wounds?
I do mention it.
Okay, so when that comes up, we're going to have some question about
Oh,
techniques or treatments to address biofilms that complicate
actually,
healing.
that I may have missed that earlier on, but the biofilms are the problem is when they occur in that back to the healing stages, when they
Yes.
occur right around that fourth stage. Once they're there, it is very difficult to address those. And so that's going to go back potentially into one of the treatments may have some impact later on it. We can look into that.
So the question was, what's the standard practice for addressing the biofilms? Is that something you want to cover or?
I won't be able to cover that in this talk.
Okay, okay.
Okay. I'd have
Very briefly, I've seen stuff where they're applying topical xylitol, topical lactoferrin, and then silver nitrate, which is a little more more napalm, I guess.
Right. Well, they'll try everything. Pretty much they go and try everything. It's pretty
Yeah,
much when they start to have these issues. There's not been a real good treatment. The only good treatment is prevention. That's about it. It's once
yeah.
a real tough one. And that's leading into the chronic condition. That's why I said there may be some help in some of these other therapies for chronic that I'll go through later.
All right.
Okay, great. Let's see. We're going to go on and look at a few of the sensor developments. There's a lot of review and development of these different sensors to go with the wounds. And some of to do all of them at one time, though, I will say is not possible. So that's one thing you must know. The temperature is a very valuable wound measurement because as you can imagine, as your wound infection is increasing, the temperature is going up. And if it's up a certain amount, that's dangerous. It can also actually go too low and there's not enough circulation. So the temperature measurement is a very good indicator of wound healing. Along pH also is very valuable, which is an acidic or basic measurement. Neutral pH is 7. Our skin is 4 to 6. Our skin is acidic. And it's that way it helps us fend off bacteria and infection naturally with our own healthy skin. When you get the bacteria involved, the pH goes up, might go up to 9 to 10. And so again, it's a really good measurement of when that infection is going down. And also what also is unfortunate is with diabetic patients, their pH of their skin tends to be higher. So there is more of a problem healing. So this pH is the two that are very readily combined can be these two measurements. We also know the glucose measurement also is a good way to look at the wound healing. If it's high, it's a problem. Moisture impact we talked about. Also with oxygen to the wound helps heal it. And also the proteins are part of the healing process as well. So those can be measured Now, all of these, like I said, are in development at different phases and not completely practical, except for a couple of them that will be talked about in a bit here. So we're going to go just a little bit about product development for these types of products. These are, controlled medical products, so they need to have FDA approval, and a lot of the wound care ones that are simple tend to be what's called class 1 products. They're fairly simple to get approved. The class 2 have more therapeutic value, and they take more effort. You have to prove more things. So some of the more serious wound therapy you can imagine is in the class 2 area. So we have in development, need to know that device type up front. And right now there are some FDA changes going on that are trying to push the antimicrobial bandages from a class 1 to a class 2. They are worried that our bodies are going to become, as we are resistant right now to certain oral antibiotics, we may become resistant to some of the antimicrobial. So they're wanting to start to really review this area. They haven't made any decisions yet, but there's a worry about that one, because they might take some of the existing products and want to relabel and change them. But in general, when you're going through the product development phase, you're doing a lot of upfront development, and you need to get into the animal test phase as soon as you can. And then there's different animal levels that you review. So you start out with typically the less expensive animals, the easy animals to study, which are the rodent family, but they don't correlate very well on skin to humans. So many of the tests right now for smart bandages are being done with rodents. So unfortunately, they're really kind of low scale and need to move up to the pig or the porcine studies to get a more correlation to humans. And that has to happen followed by biocompatibility testing to make sure that things are safe before we ever even have a clinical on new materials or any devices. So as far as development goes on changing and making complicated bandages like these smart bandages, you can imagine, I expect it to be a difficult and longer process than you might guess. So the general thing people are saying as we get to the complicated devices, it could be about a decade is what people are feeling, although I'm hoping there are some in-between developments. So we're going to now go into some specific case studies. And let's see here. Okay, I got a couple samples for those. The first one, this one is a hydrogel, and it's been modified with the silver ions so that it has been proven to kill 3 types of bacteria, and there are many types. So the FDA requires that to be specific in the claims, what type you're talking about. And this particular one didn't require an FDA 510 approval, but the company decided to do it anyway. And what's turned out is quite interesting is that the main area that this product is growing in has to do with athletics. And what happened is that we have put in so much artificial turf and indoor artificial mats for gymnastics and wrestling. We've created a breeding ground for bacteria. And this is a serious issue. If you have just a scrape can you imagine off a football field, you could get staph from a scrape. So this particular gel has become real popular in that field. And you can see here's a sample, and it's got a little bit of a gray color. There's a mesh in there with the silver integrated into the material. So it also provides a bit of pain relief because when you apply it, there's a bit of evaporation and there's a cooling effect through the backing. So it also provides some comfort. So moving on, we'll gradually get a little more complex, but here's the next one, which is a wound. This is actually a pressure wound prevention product. So so many people in the hospital settings have to be bedridden, and with pressure on the bony parts of your back and your buttocks and whatnot, you will end up developing these sores, which can become very complicated to heal. So an approach to solving that issue is with a multi-layer system here, where you have a low friction film, a non-woven, a softer film, low trauma adhesive, and this is supposed to be helping now with a cost-effective solution to reduce the pressure wound sore problems that occur in the hospitals. And we move on again to more layers, and in this case we have the goal of making a product as reusable as possible with electronics. And to do that, there's a joint design performed here where the there's a layer on the, let's see here, this would be the skin layer here. There's a little bit of circuitry built in here. There's an adhesive down here. This goes to the person's side. This is the electronics up above, and you can then recharge this section and whatnot. And this product, the disposable one looks like this. So it's got adhesive on the bottom that you can see this peels, and this is the part that would be later thrown away. And this one's been but used with an ECG. And one of the things that I found in working with wearables is that many of the designers start out and they make the wearable out of a rigid plastic. Can you imagine a rigid plastic on your chest? It's not going to do very well. So that's an area they've gone to the foam, more of a molded foam approach. And I think that's a really good area. Like, again, that's a material change. And where you can use that, I think there's some advantages. So now here's a very important therapy that has moved into successfully dealing with the chronic wounds, especially the diabetic wounds. And it's called negative pressure wound therapy. It involves, if you take a look at this diagram down here, this is a skin simulation, and you see it's kind of deep. So this is supposed to show you that this therapy is often used with a wound that goes beyond your skin. It could go down through your fat, your muscle, to your bone, even, and it can go way deep. Okay, so you don't want it to heal over the wound. It won't heal correctly. So you want it to heal bottom up, inside. And so how do you do that? Well, this therapy was developed about 20 years ago, and there are a variety of kinds of foams here that are different kinds of absorbency. Some have antimicrobial materials, some have drugs built in, and this is positioned into the wound. And then there's a top layer here that would be either a film with adhesive, or it could be a drapery, but you have to have it closed enough that it keeps a vacuum. So again, some places that people on a strange geometry in your body that's not flat, they might use that alginate material I talked about before and form a seal with a drapery in that alginate material. You then have a tube attached to a vacuum pump. And then the first step then is this early removal of the excess fluid right off the bat will typically increase the size of the wound opening by about 30%, and even a little bit more, which is, and also remove excess fluid. So in the first hour or two of wearing this therapy, you've already reduced your wound size that much. And this is quite a huge benefit. Apparently there can be a bit of pain associated with that first, application, but it's really a kind of a breakthrough to start out with an improved, reduced area. So this dressing then needs to be changed fairly regularly every few hours during the early stages of use. So obviously the person needs to be in a hospital or care setting to accommodate that. And then over time, it's kind of an average of about 40 days for some of these difficult diabetic wounds. It can take, this then will be replaced with another type of dressing. Once that deep healing has occurred and it's getting up to the epidermis and dermis, then you switch over to other dressings to finish the healing. And again, this technology took quite a long time to develop. Company with the gold standard was called KWI, and it's been recently purchased by 3M and continues to have now competitors with smaller, more portable devices. When you're in the hospital, this is called wound back. There's wound back everywhere. That's what they call it. And then there was a 5-year study performed with this material, and they pretty much found that this was absolutely, compared to other methods of healing, this was by far the only one that was very successful. And the recommendation was that it should be used everywhere that it's possible. Well, it's not possible actually to use this everywhere. If you have a blood vessel nearby, you cannot be pulling vacuum. If you have had cancer, they don't recommend using this method. So this is one that's again, this was one that would be used with wounds that can't heal. So would it resolve the biofilm? I don't know, but this could be an approach where you've got a difficult to heal, and this could be used. And the last item that I have here is really the real research that's looked at to develop smart bandages with the wound care monitoring being done with electronics. So back to looking at typically the diabetic foot wound again is kind of the case that people want to go after. because it's so problematic. And this device then would have on the base, it would have a hydrogel touching your skin and could well be drug loaded, and it probably will be in this case, it's conductive as well. So it's got a dual purpose or it's an adhesive, it's a drug loaded, and it'll be able to provide the medium for electrical stimulation to the wound. Oops. And I missed a slide here. What did I do? Okay. So the top the top section here can be different kinds of flexible polymer, and of course your electronics are in the middle. So this is a Caltech study, and there's about at least half a dozen universities right now, and it's funded by NIH, doing very similar studies. And most of them are using pH and temperature as the sensing method. And in this case, diabetic rodents were used as with a control for a 14-day study. And they used the electrostimulation, the drug release, and had an improvement and a reduction in healing time in all cases with the diabetics with the stimulation treatment. So this is the one that, again, I've seen similar studies repeated from different universities, and this appears to be the approach that is, I think, most likely to move forward. And you'll see then more and more uses for this hydrogel. So that's that. There's a lot of research going on right now in the hydrogel, as it turns out as well. So as we move forward, then we see that there is a place to improve in materials, designs, and this is also to be integrated with these various, electronic developments, which include all the therapeutics we talked about, the different stimulation techniques, as well as the monitoring. Now, the miniaturization, of course, plays into play, stretchable electronics, energy harvesting. It's a whole other array that we could develop a whole nother presentation out of. But this intersection of technologies is what is happening now. And so that is where I think the excitement of smart bandages is really that it's going to happen at some point in time. So key takeaways, I think we've all learned that this wound challenge issue is here. In some cases, it could actually even increase in a problematic way with increased diabetes and increased aging population. So wound challenges, if anything, are going to grow in terms of how many people are going to need treatment. We know that the advances in materials and therapeutics and monitoring are going to continue for sure, as well as I think important outcome of this should be that we have a little bit more say so in our personal care now, so that we could do monitoring remotely, for example. There are certainly other options being developed. And I think when you look at yourself as a person going into care conditions, when those people are reviewing the patients, it's really important for the information to get out. I think it's easy to have someone in a situation like that. There's not enough information. They might not give you the optimal treatment because you might have more care than they know available. And so the last thing that's of concern for me anyway is some of the regulatory changes. But overall, I feel that the conclusion of this is that the smart bandages are going to be in the future. And I think we'll all have a chance to see that happen.
Thanks, Joanne. That was quite interesting. That was quite it's an area that's not very sexy, but it affects a lot of people.
Yeah, I know.
I mean, it's um for a variety of reasons, either post-surgical or diabetic complication or just bedridden. It's good to see a lot of this come out. In your early diagram and in your wound progression, one thing you pointed out was that the body is trying to get certain kinds of cells into that area. And I'm wondering if the suction device, by removing that excess fluid, essentially reduces the pressure, the back pressure, and lets the macrophages and the other kind of building block cells get in there for the remodeling.
It's definitely accelerating that phase,
Yeah.
reducing the inflammation phase, which just takes a couple days, right? So if you've
Yeah.
reduced that, the only issue with the chronic wounds is they've been around a while usually. But they will use this treatment in certain surgical areas as well. You know, the right kind of surgery. They can go in and they get a lot of fluids in surgery. That's why
Yeah.
there's a lot of applications in surgery that I'm not completely familiar with. I have a friend who works in surgery and says they have wound vacs everywhere. They use them constantly because there's so much fluid, so they're using lots of foams and whatnot, but they do like this vacuum therapy to speed things along.
So we had a question on what makes a wound chronic, or did you say it was a 30-day timeline,
Yeah,
or what's the?
they use that time 30 days, and often what has happened is that biofilm may have happened, or it is just simply so deep beyond the skin that they just can't get it to heal from the bottom up. I had a family member who had this issue where they had a non-malignant tumor removed. It was quite large, like the size of a grapefruit. It healed, skin healed right over it, right over it. So there was an opening. They had to go back and do it again. And so there wasn't, this was a number of years ago without the technology. And so some family members they came up kind of their own method of dressing changing and using some other natural products. And they just diligently did that and it did heal. But that was a case where the negative wound pressure therapy would have been a real advantage for that type of wound.
I think the other thing that's happened that's helped mitigate this is the minimally invasive surgery
Oh,
leaves much smaller incisions and
oh,
uh much smaller
yeah. If you can imagine having stomach surgery, open stomach surgery versus, robotic surgery instead.
right.
Imagine the difference in the pain and suffering and even the healing process. So it's been huge for some areas. It's
I think the other thing the negative pressure is doing is in a lot of the cases of the chronic wounds, you may have poor vascularization. You may have very poor secondary and tertiary kind of veins and capillaries. And so that you're just getting a mechanical assistance
right.
to pull stuff in.
Yep. It could have, it should happen naturally, but it's just, this is just a big assist.
So we had a question on amino acids that I found a link for, but I'm just curious. Have you seen much use of either topical or amino acids introduced into the diet to assist in the healing?
I haven't really reviewed that area.
Okay. Okay.
Joanne, I have a question.
Sure.
So, not so much for smart bandages. I teach wilderness first aid or wilderness emergency care.
Okay. All right.
Okay,
Yeah.
and it was interesting that you were saying that gauze is falling out of favor because it tends to dry out the wounds too much,
Hmm.
which is what we've been teaching for a long time.
Right. That's right.
So there's a couple of questions come up. Now, I don't see smart bandages being carried in wilderness first aid
Oh, no,
for a long time.
no, no.
I think that area has to mature a lot, and probably a lot of additional training. Clinicians will be using them for a while before we even think of lay people, having them in their first aid kits. So, what other dressings would be appropriate for taking in emergency care?
Yeah.
Now, there's two things. They have to be able to be used by lay people with modest training.
Right.
And the second thing is expiration date. If they have a short shelf lifetime, people will be throwing them out of their first aid kits routinely and
Right.
probably won't bother, replacing them. So you got any recommendations on what
Yeah, it's
might
a
be
couple things.
appropriate?
One is to absolutely get that wound, it needs to be really clean, and that hexidine material is great stuff.
Uh-huh,
I would highly recommend carrying that to get that in there. And then what you need to do is, of course, following the steps, you got to stop the bleeding, right? And then you've
right.
got the wound on, you want to keep that wound moist. That's the biggest issue that goes wrong with that gauze. The gauze is great on the outside, so you would want to have some, sterile pads that you could use. You could have the transparent dressing to use for scrapes, you know, and simple heel rashes. People are using those hydrogels actually, and you'll see kits with hydrocolloids for feet blisters as well. Those things can turn nasty, right?
Oh, yeah. Oh, yeah.
Those are, and again, back to prevention on that, some of the hydrocolloid dressings in advance. as well as before the injury even starts, there's some fairly heavy duty, just basic cloth tape. That I've had a foot doctor recommend that as a runner that she just uses this tape. It stays on and it rubs that, not her ankle, not her heel. You know, so it's that prevention.
Okay.
Really
Yeah.
taping up that heel. Actually, just with tape, or one of the colloids, one of the hydrocolloids.
So
Mhm.
one more for accidents and bleeds. They now make a number of bandages that have clotting factor that stop bleeding much more quickly. They're typically gauze, but for emergency, for wilderness, you might think about that.
Yeah, you need to stop the blood. I mean, that's however you do it, you've got to get that clot. You've got to get the, as you
Yeah,
know,
that's fun.
that's whatever.
Yeah,
Yeah.
those bandages, Sean, have a very limited lifetime. They're expensive and with a limited lifetime. So most of the people, don't want to invest in carrying them. Now, if you're on a big expedition, you're going to climb Mount Everest. Okay, that's a different thing.
Yeah.
You've got a huge population and a lot of Sherpas to carry your gear along.
Mm-hmm.
But for people that are backpacking, they get very frugal with the weight.
Mm-hmm.
So yeah.
Yeah. Well, if there are no other questions, I want to thank Joanne for a fantastic presentation. And I think we will break here.
Great. Thank
Okay.
you.
Thank you.
Thank you very much.
Thank you.
Okay, thanks. Thank you.